Hello, my name is Chatushka Samadhivakara and today I'm going to do a short video about some concepts of health and disease. This is my name and the date that I am doing my presentation. And I have written down all the topics that I'm going to talk about today. The first one is a disease definition. Disease is considered as an acute or chronic illness. It can be acquired or can be born with. And it causes physiological dysfunctions in our body systems. And each of disease can be have specific symptoms and signs, and it can be characterized its pathology and etiology. When considering the aspects of the disease process, it includes etiology, morphological changes, pathogenesis, clinical manifestations, diagnosis, and clinical course. The second one is disease classification, and disease can be acute, subacute, or chronic. Acute disorder is one that is very severe, but it is self-limited, whereas chronic illness is prolonged and it is a continuous process. In chronic diseases, it have exacerbations and remissions. Subacute is between acute and chronic. It is not severe as acute and it is not prolonged as chronic. When looking at the spectrum of a disease severity for infectious disease, there can be preclinical, clinical, and subclinical. During the preclinical stage, the disease is not clinically evident, but it is going to progress to a clinical disease. And in subclinical diseases, it is not clinically apparent and it is not going to progress to a clinical disease. And clinical disease is manifested through signs and symptoms. The next one is etiology. Etiology is the cause of the disease. There can be biological agents such as bacteria and viruses, and chemical agents like poisons and alcohol, physical agents like trauma, burns, and radiations, and there can be genetic inheritance and maybe the excess or the deficits of the nutrition. The next one is pathogenesis. Pathogenesis explains how the disease process starts or evolves. It is a sequence of cellular and tissue events that take place from the time of the initial contact with the etiological agent until the expression of a disease. So it's a sequence of events. And the next one is symptoms. Symptoms is a subjective complaint. It is a subjective complaint by the person who has the disorder. And examples for the symptoms may be headache, dizziness, shortness of breath, and the next one is syndrome. Syndrome is an objective data that can be get through an observer other than the person with the disease, such as swollen extremity, elevated temperature, and changes in pupil size, like that. And syndrome, it is a characteristic of a specific disease state, and syndrome is a compilation of signs and symptoms. The next one is the diagnosis. A diagnosis is the designation to the cause of a health problem. To get the diagnosis, there's a process which requires a history, physical examination, and diagnostic tests. Through a careful history, we get to know about the symptoms and its progression, which contributed to a diagnosis, and through the physical examination, we can get the signs through the observations for the altered body functions, and for the diagnostic tests, and through diagnostic tests it can be about the diagnosis. The next one is complications. Complications are possible adverse exertions of a disease, or it may be an outcome from a treatment. The next one is prognosis. Prognosis refers to it can be the outcome from the aspects of a recovery from a disease, and it says the chances or the anticipated survival time. And prognosis is often presented in relation to the treatment options. And the last one is diagnostic tests. It includes laboratory tests like blood tests, urine tests, and imaging studies like CT scans, PET scans, and some other tests. And the value of many diagnostic tests is based on their reliability, validity, sensitivity, and specificity. And it is very important to know the normal and abnormal rates for a diagnostic test, and the normal values for the laboratory tests are adjusted to the gender and age. Yeah, that's all I have to talk about today. Thank you so much.